Many patients incorrectly identify the medicines and dosages they are prescribed, complicating the clinician's ability to complete the medication reconciliation process. Furthermore, patients who are incapacitated or unconscious at the time of admission will not be able to relay this important information. Accurate and complete medication reconciliation is critical to patient safety. Harm from medications, including adverse drug events, remains a top patient safety priority in hospitals and across the care continuum. To ensure patient safety, medication reconciliation must occur at admission, transfer, and discharge. Additionally, the 2015 National Patient Safety Goals added a new requirement that addresses the patient's role in medication safety. The requirement states that organizations must inform the patient about the importance of maintaining updated medication information. The targeted population for this technology is clinicians, pharmacists, and patients. Upon admission, the most up-to-date list of medications is provided by the patient and entered into the electronic health record by the nurse. The list includes the drug name, dosage, frequency, and route. The admitting provider then reviews and confirms the medication list, which completes the reconciliation process. If a patient is transferred or discharged home, the physician is responsible for reviewing the pre-admission and current medication list and determining which are appropriate for the patient to continue taking, resume taking, and/or stop taking. Since it is critical to engage patients in all aspects of their care, patients must understand the importance of managing their medication information. Patients must be instructed to update their medication list when medications are changed, discontinued, or added. It is important that patients also document any OTC medications they take. To assist patients in accurately managing their medication information, an easy-to-use patient medication database will be created. Through this technology, patients or their designee can scan medications using a smart device and the barcode label on the bottle to upload medications into their personal database. The barcode contains the medication dose, frequency, and route. Therefore, once a medication has been scanned, these details will automatically upload to the database. When medications are changed or discontinued, the patient or designee can simply log into the database and edit the medication list. The personal medication database is able to integrate with both the patient portal and the electronic health record. This integration allows for the seamless transfer of medication information across the continuum of care. When a patient is admitted to an inpatient care setting, the nurse will be able to open the electronic health record and view the medication information that the patient has entered into their personal database.
Great job using your personal medication database.
Additionally, the primary care provider will be working from the same list. Any medications entered by a physician or pharmacist can automatically upload to the patient's database if the technologies are integrated. Since all medications will be stored in one place, the technology will alert the user of any possible medication interactions that exist, including interactions with over-the-counter medications. As required by the Joint Commission, this technology engages patients in maintaining their medication information. Furthermore, if the database and patient portal are integrated, patients will be more likely to utilize other functions of the patient portal, thus enhancing patient engagement and outcomes. As with all protected health information, the patient medication database must follow the same HIPAA and high-tech rules as other health information technologies. When used appropriately, the medication database will result in fewer adverse drug events. Patients who experienced an adverse drug event were hospitalized an average of 8 to 12 days longer than patients who did not, and their hospitalization costs were $16,000 to $24,000 more. The personal medication database is an enhancement to existing technology, such as the patient portal and electronic health record. The patient will not be charged for utilizing this technology. Software costs will include the medication database program and interfacing. There will be no additional hardware costs since patients will be required to use their own smart devices to upload medication information. Minimal staff and clinician training is necessary because information will be automatically uploaded into the medication reconciliation portion of the electronic health record. Additional IS support will be needed to ensure functionality of this technology. Prior to fully implementing the medication database, testing that includes patients, IS, and clinicians must occur to ensure functionality before going live. The implementation of this technology and its use must be communicated out to all staff and clinicians. An organization-wide communication plan is essential for transparency about the development, rollout, use, and maintenance of the database. Though in-depth training on this technology is not necessary, an electronic education module should be developed to inform and educate staff and clinicians on the use of the medication database and its impact on the medication reconciliation process. The success of this technology depends on the patient's level of understanding and engagement with the medication database. Therefore, initial access to the database should occur during the patient's visit or hospital stay. A case manager should be utilized to educate and train the patient on how to use the technology. In addition, a health literate brochure should be distributed to the patient for use at home. Use of the medication database must be incorporated into existing policies and procedures regarding the medication reconciliation process. This will ensure all staff and clinicians are aware of the patient's responsibility to maintain accurate medication information. As required by the 2015 National Patient Safety Goals, clinicians must develop patient education regarding the patient's responsibility in maintaining their medication information. Education and instructions on how to access the medication database should be included in the patient's discharge instructions. As with existing patient portal, the same policies and procedures for ensuring the privacy and security of protected health information must be in place. The expectation of the patient medication database is to ensure that complete and accurate medication information is available to the clinician at the time of the patient's clinic visit or hospital stay. The current medication reconciliation process can take an average of 30 to 60 minutes of nursing, clinician, and pharmacy time for each patient admission. Through patient engagement and the use of the medication database, organizations can expect to see this timeframe significantly reduced. Application of the model for improvement will indicate whether the implementation of the patient medication database has resulted in improvement. The healthcare organization will need to set aims and apply the PDSA cycle to evaluate the technology and make changes to facilitate continuous improvement. Lastly, efficacy will be demonstrated through improved patient outcomes, specifically related to adverse drug events. Medication errors are one of the leading causes of injury in hospital patients. A study of hospitalized patients on a family practice service identified 0.5 medication reconciliation errors per patient on admission. An up-to-date and accurate medication list is imperative to ensuring safe medication prescribing in any setting. This technology would assist healthcare organizations in meeting the Joint Commission regulations pertaining to medication reconciliation. The patient medication database will improve patient engagement, resulting in increased patient satisfaction and improved outcomes. Healthcare organizations that integrate this technology with their electronic health record and patient portal can expect to reduce adverse drug events and will ensure continuity of care across the continuum.